Good afternoon, and must thank each and every one of you and Dr. Sri Kumar and the organization for allowing me to speak something about stem cells. I'm not going to take much time because most of us are already hypoglycemic. And so now the stem cells basically cause a lot of controversy, even among the medical community. There's a lot of people coming and talking about stem cell banking, stem cell research, stem cells for rejuvenation of organs, treating of diabetes, treatment of cancers, a lot of things. Even before a child is born, today the mother is bombarded with literature about how to store stem cells. So we'll try and clear out some of these misconceptions about stem cells today. So let's come back to our basic medicine. What happens when we get injured or something wears out? Basically, the immune system clicks into action. Once the immune system is into action, the body repairs itself. It starts to regenerate itself. It starts to form new cells and replace the cells that are gone away. Injured tissues healed by a blend of repair and regeneration. In small children, it was found if a child is below the age of maybe 1 year and he loses a part of his finger or a part of his toe, there is a possibility for it to completely regenerate if the wound is left open and if the wound is left wet. But unfortunately, as the child grows, we lose this ability. As we grow older, we see that we have many injuries like brain injuries, heart injuries, infarcts in the brain, infarcts in the heart, broken bones, all heal themselves. Tissues regenerate new functional cells by two methods. One is either by directly dividing the existing functional cells, or by number two, which is activating adult stem cells in the population. Now, what are these adult stem cells? There's a lot of controversy about it. There are a lot of ethical issues people are bringing up about this. The American Academy for Stem Cell Research has banned stem cell research to some extent. The church is not allowing stem cell research to some extent. A stem cell must make copies of itself. These copies sometimes are better than the old stem cell itself or the old cells. That's how the body regenerates. That's how the body becomes better. That's how the body regenerates and helps us overcome infections and kind of injuries. Adult stem cells. These stem cells give rise to all cells in their tissue. Now, an adult stem cell, for example, it gives rise to a cell in its own tissue line. Like, for example, a bone marrow cell can form new blood cells. A limbal cell can form new corneal cells. But a limbal cell cannot form new heart cells. That's what adult stem cells do. But embryonic stem cells, they can form any cell in the body. Now, if you see, our bodies also store adult stem cells in various organs. Like blood has some amount of stem cells, but very, very limited and very difficult to get a stem cell yield from blood. The gut has a lot of cells. Skin definitely has a lot of cells. In fact, in hair removal, when we talk about laser hair removal, we destroy the stem cells around the hair follicle so that you don't get new hair growing again and again. Bone marrow, liver, cartilage. If you see, during development, the inner cell mass or the blastocyst, the cells actually divide into three main layers: the ectoderm, mesoderm, endoderm, and the germ cells. And as Dr. Sri Kumar said, right in the first session, that all these cells are first somewhere over here. We start out over here, and then gradually we differentiate. Now, what our research tells us, or what today's research can do, today's research works up to here. So we can regenerate parts of each of these organs by using some of the these cells, intermediate cells you call them, or intermediates. So again we see the embryonic stem cell, basically endoderm, mesoderm, ectoderm and germ cells, what parts of the tissues which it forms. Scientists today have found out that they can generate embryonic type stem cells from adult cells. If you see, this is an unfertilized egg. This unfertilized egg is taken, the nucleus is removed. You add a somatic cell, you transfer the DNA or the nucleus, because the DNA of every cell has the entire genome of us, has the entire, entire history, it has everything about us inside. So you transfer the genetic material into the egg and you activate it. This is like a fertilized egg or a fertilized egg equivalent. Now this can be implanted and it can grow into another same species, what you call it, the clone. This prompted all the ethical committees around the world to raise ethical questions. Whether is this ethical? Are you creating another human being? Are you creating another human being, or are you creating another species and sacrificing it just for our own needs? These two cover magazines of Nature Medicine and Time put the whole world into a fire and the ethical debate about cloning. So, because of this, embryonic stem cell research is banned in many of the countries, many of the Western countries. If you see again a recap, that adult stem cells are found in the gut, liver, pancreas, brain, heart, and in the eyes and in the teeth. Again, if you see somatic stem cells, if they are cloned, they can provide patient-specific cells. Up to this stage, it is allowed. Up to this stage, you can do drug testing on these cells. But more than this, they say that the embryo becomes viable, and I think ethically it's banned. So majority of the embryonic stem cell research does not create new stem cell lines. So what we are left with is adult stem cells. Today, if we have any kind of therapies, the therapies are related to adult stem cells. We use the adult stem cells because in India, we cannot use embryonic stem cell for research. We cannot use embryonic stem cell for treatment. Legally, it is banned, it is not allowed. So there are some differences. You see, an adult stem cell resides near their tissue. So if a skin cell will be always in the skin, the eye cells will always be in the eye, especially at the junction of the two tissues, like in the limbus, where the cornea joins the sclera, or where the dermis joins the epidermis, in the junctional tissue it's called basically. An embryonic stem cell is created from the cell mass that exists only in the early stages of the embryo. Adult cells are capable of giving rise to some functional cells in their tissue, but not the entire tissue itself. Like you cannot generate an entire heart from an adult cell. You can help the infarcted part of the heart regenerate to a small extent, to a microscopic extent. You can have micro blood vessels grow, but you can't regenerate an entire heart. But it's possible in tissue engineering with embryonic stem cells. Today, most of the leading problems in the world, this is the 2001 statistics in US. People die from heart disease, cancer, stroke, chronic lung disease, diabetes. Obviously, diabetes and obesity come up now number one. Alzheimer's, cancer is also a very, hot topic in stem cell research. Because there are many debates that the cells that you reintroduce into your body, can they cause cancer? We'll come back to that topic. Now if you see, the heart is an example of a non-regenerative organ which is frequently injured. The heart regenerates to some extent, but you always, after a major cardiac event, you have a scar. Now, we have seen that if you inject cells at the site of the injury, the scar may reduce. The scar may not go away, the scar may reduce. You may open more collaterals. giving more blood supply to the heart, reducing scarification tissue on the heart, or perhaps anywhere in the brain is always good. We do not want scar tissue. If I reduce a person's penumbra in the brain after an infarct with stem cells or with growth factor, I save more brain tissue. That's much better than having the person heal naturally. Definitely he's going to heal. But if you give him some kind of stem cell therapy, which is ethical, which is derived from other stem cells, from the patient's own stem cells, or it could be genetically engineered stem cells, the person will heal better. Now coming back, everybody spoke bad about this picture. I got a little bit scared because in India we believe that this is a sign of prosperity. But today's lecture will give us little hope, maybe 5% we can get hope by having this kind of a structure, 2% maybe if not 5%, because abdominal fat is found to be rich in stem cells, or pre-adipocytes are surrounded by stem cells, which can be used to treat patients. Now osteoarthritis, you see, is rising all over the world, in the United States as well as in India. People, because of obesity, because of diabetes, complain of knee problems. They cannot sit for a long time, they cannot stand for a long time. So you see again arthritis is growing on the climb. These are the golden years of life. I mean, it's up to us if we want to spend part of our life in the walker and taking a handful of pills, or we want to, do the better things that are there in life. So the current treatment options for OA are NSAIDs, joint replacement. We can give some hope by adding autologous stem cells. You take off the patient's own stem cells, either from the blood or from the fat. We culture them and we put them back into the knee by intra-articular injection. See, these stem cells are already there in your body. So why do you have to do all this tamasha of taking them out, culturing them, re-injecting them? Because these cells are not active, they are not activated. So once we take them out, we culture them and then we put them, then they help the cartilage to form. Of course, cartilage cannot regenerate completely, but micro blood vessels in the cartilage start regenerating. The vascular endothelial growth factors, the VEGFs, start regenerating. That reduces pain, that improves mobility. So if you see, first, the veterinary people started using this to treat injuries in dogs, injuries in animals, autologous stem cells, and that's how we copied them. So basically, animal studies show far its use in rheumatoid arthritis, in osteoarthritis in tendon. Human studies have shown that it's used a lot in rheumatoid arthritis, heart disease, liver and leukemia. Heart disease, not to that extent, because you have to have access to a cardiologist who is willing to help you to inject them at the site through a catheter, of course. So some tissues of adult stem cells can become heart cells by transdifferentiation, or the phenomenon of homing. We take off these stem cells, we put them in a Petri plate, we add growth factors so that these cells basically home towards becoming heart cells. Then those cells are taken and injected at the site of the injury, or at the corneal, at the coronary artery which was blocked. Of course, it won't open a coronary artery, but it will help